Hi, this is Dr. Roshini Rohit, consultant obstetrician gynecologist at Motherhood Hospitals, Chennai. Now I'd like to talk about a topic called as postmenopausal bleeding, something which is not very widely discussed, so an awareness needs to be in this case. So what do you call menopause? Menopause is when someone has not had their cycles for a minimum of 12 months. And what is postmenopausal is when you have any vaginal bleeding after those 12 months, we call it as postmenopausal bleeding. So when do you need to go to the doctor? Anyone who's attained menopause and they have vaginal bleeding need to immediately see a gynecologist. There are a lot of reasons for this bleeding. So one of the most common reason would be because of the withdrawal of the estrogen, they will be having thinning of the vagina. So there is some amount of bleeding because of that. Cervix can be inflamed or there might be an infection. Then also they will have some amount of spotting or bleeding. Followed by that, you may have an endometrial polyp. But what we are really worried about is endometrial cancer or cervical cancer, because in both these cancers, the vaginal bleeding is one of the first symptoms that occurs to the patient. And when caught early, that is if they are in stage 1 or the precancerous stage, it is completely curable. And along with that, when they come to the doctor, the first thing we do is of course an examination. We do a pap smear, and followed by that we do an ultrasound. In the ultrasound, we look for of course a polyp, or if there is a endometrial thickening. If there is an endometrial thickening, we do something called as a DNC, which used to be done before. Presently, the gold standard would be to do a hysteroscopic guided biopsy. That gives a more accurate result. Followed by the biopsy report, we will take a call. If it's endometrial hyperplasia, it can be treated by medications, but in case it is an endometrial CA, we will have to proceed with the surgery, and following on the biopsy result of the surgery, it will be decided whether surgery itself was enough, or do you also need further management with an oncologist. Following by the hysterectomy or the removal of the uterus and the biopsy that we send for, in case it comes positive for cancer, further management actually depends on the staging of the cancer, which will be managed again by the oncologist, surgical and medical onco, as well as radiotherapy. So the most important thing is, in this age group, women are shy to come and tell they had even a spotting or a bleeding, or they just leave it off because of lack of awareness, saying I just had a minimal bleed, I just had a single spot. So they don't even take the symptoms seriously enough to come to us, and most of the time, by the time they come to us and actually say the symptoms, it is quite late to do anything about it. Of course, all the other reasons which causes the vaginal bleeding are simple and they are curable, but what we are really worried about in this case is the endometrial cancer and the cervical cancer. The take home message from this would be, as soon as a postmenopausal bleed occurs, or when you have some amount of spotting or vaginal bleeding, please immediately go and see your gynecologist and do not ignore the same. Thank you.